My role is a new one. It's been developed over the last 18 months or so and is intended to really reflect what we are as a clinical commissioning group, putting patient engagement and experience at the heart of everything that we do. Engagement for me as a GP is about listening, communicating and informing patients, whereas experience for me as a GP is about taking what patients say and actually using it to influence the decisions that we make about their healthcare. That ethos for us as a clinical commissioning group needs to thread through everything that we do. For me, as a GP, a good patient outcome is just as important as a good clinical outcome. In terms of what we've done to date over the last 18 months, every practice of our 37 in West Cheshire has an active patient-led patient participation group. We have a West Cheshire Patients Panel, which has been established as an extension of our previous membership scheme. Patient participation groups will feed into that, and anybody is welcome to be a member. It's about getting people on board, getting the message across to people. From our patients panel, we can then select citizens' juries based on strict criteria to look at a particular area of interest, such as diabetes, to consider and feed back to the board their recommendations. We're very interested in social networking. We have a very active Twitter page and we're looking to develop Facebook. Every one of our 37 practices has a very interactive website for their patients, which in turn feeds into our clinical commissioning group website. That will also be intended to have a patients forum where they can go on there and discuss and feedback. We're developing a blog, and that is intended to get our message across. We're GPs, we're at the heart of everything that's going on, so let's tell people about our journey. We have our West Cheshire Health Matters Bulletin, which goes out to everybody in Western Cheshire and is yet another way of us engaging with people. We're very enthusiastic about young people's engagement, working with our youth parliament, listening to what they say and setting up services that they're asking for. Compliments, complaints, surveys, everything that we get from practice level and upwards, listening to what patients say and using that to identify trends that we can act on and can inform our commissioning decisions. We're also very keen to pursue the idea of shared decision making, which is a national priority, but it's something that we want to really embrace locally as clinicians working with our patients to get them really involved in their care. And I think the most important thing is to remain open to feedback, open to comments, open to criticism, and using that information to inform what we do as clinicians, putting patients at the heart of their healthcare. So it really is no decision about me without me.